right, good morning. My name is Stephanie Flood Thomas. I am the team commander for Florida 4 DMAT, which is a disaster medical assistance team. We are happy to come in with the National Disaster Medical System, which is a part of HHS, which is Health and Human Services. And you may hear the term ASPR, the Assistant Secretary for Preparedness and Response. We're here to help backfill these lovely people here at Our Lady of the Lake Hospital. They have a need because they have a surge of COVID-19 patients, and our job is to come in and help them in any way we can to staff their facility, to help their staff to get a little bit of a break, if you will, not being so overwhelmed, and to help fill in some hospital beds that need some staffing. So we're working well with the admin here, and I'm happy to take any questions you have. Any questions?
Where have you guys been in the last year? What stop is this for you?
Okay, well, this is actually my first mission as a team commander. I was previously on Florida 6 DMAT, which is also here. I know many of my team members. In fact, my safety officer, I think I'm his 31st team commander that he's worked with in the COVID year and a half if we've been going. We have multiple different groups here. I think there's Colorado 2, Colorado 3. I have Ohio. I have Florida 4, which is Jacksonville, Florida area. I myself personally am out of South Mississippi, out of Pascagoula area. We have people from Florida 5, which is Miami, Key West. We have Texas, California. Who am I missing? Maryland. We have Maryland 1 team here. Tennessee 1. Forgot about that. Anybody else I missed? Alabama. Oh, Alabama 3. Steve White is here. He's the team commander there, and he is helping me out. Basically, these responses we deployed at the last minute, so many hospitals are requiring their staff to stay there because they're so overwhelmed. So we had a whole bunch of team members jump in and backfill us so we could go. Many of our team members have been out on multiple deployments for COVID. My personal self, I haven't been in the system for the last 3 years, but I was at Hurricane Maria in Puerto Rico and Caguas. I was the CMO for all of the medevacs coming out of the U.S. Virgin Islands and Puerto Rico. I was at the CDC for the Ebola response. There's a whole bunch of others, but that's basically a little bit about us. Any other questions?
What's the timeline? How long are you guys going to be here?
Okay, excuse me, let me get this up a little bit. We will be here for 14 days. We are scheduled to have another team come in. Rhode Island 1, if I remember correctly, will be coming in on the 11th, and we'll have a couple days of a transition so that their team will come in, backfill us, and then we will demote back to our homes. But at this point, I believe we're at a 30-day mission. Is that not correct, Heather?
That is what we're tentatively planning for.
Yeah, for right now, that's the current status, but that's subject to change. We're willing to work and flex as we need to.
Are there any specific challenges in parachuting into a new system or a hospital? I guess you guys are trained for this. But,
Yes, many of our providers have had many years of experience. We have done this on multiple occasions. The first couple of days are a little rough. I will have to say this transition has been wonderful. The staff here has been fantastic to work with. We have got a plan as far as how we're going to backfill using their staff to help our staff to orient, because again, we're in a new house. So that will give us a little bit of a lead so we're not so behind the 8 ball. A lot of times we come out and we actually set up, we call it a base of operations on a parking lot basically, and we'll take patients out there. Currently we're going to be helping in-house, so we're flexible to do whatever they need us to assist with. We have paramedics, respiratory therapists, nurse practitioners, nurses, docs, PAs, safety officer. Who am I missing? Pharmacists. Oh, yes, I can't forget them. They're the wonderful people. I've deployed with a couple of our pharmacists on many occasions. They're always a great asset. A lot of times if we're on the boost system, which is outside, say for Hurricane Katrina, people lost everything, so we have a cache of pharmacy stuff that we will help to get those people their needed meds, at least in an emergency situation. This mission does not require that. But we're going to backfill their pharmacy to help their staff. Okay. Any other questions? Yes, sir.
So how do you evaluate when it's time to end the mission?
Okay, that goes through the hospital administration. If their staff is or if their hospital is adequately staffed, that will go through HHS. The request goes up through the state, through to DC, and then everybody up top works and they tell us what we need to do. So it's based on what the hospital need is, but we coordinate through the Louisiana state officials as well as through DC. Okay.
I guess you want to say anything? Here we are in a 4th surge in Louisiana. It must be somewhat strange to be deploying for a COVID surge at this point with the vaccine available. I mean, what's the general mood of your staff, and what's talk to us how you guys are thinking about this.
Well, our job, we're here to help. Most of us here, we want to help people do whatever we can. That's just our nature. We're happy to be adrenaline junkies, basically. A lot of us, we want to be in the middle of things. Our job is to make calm out of chaos. That's what a lot of us are really good at. As far as the vaccine, we encourage you to get the vaccine. If you know somebody who can't get there, get out and help them. Take them to the vaccine clinic. Try to work with your local officials to get to a local facility. Call your public health department and ask them where the vaccine stations are set up. You can go, a lot of the pharmacies have it now, but just get people vaccinated to help reduce this risk.